So I will try to speak slowly enough and enunciate enough that it gets across. When it's necessary, I can give you Spaghetti Deutsch. It's a special version of German from New York. On the board here is Legacy of Wisdom, Weisheit im Fluss. Go with the flow, baby. That's my old hippie language. And we're going to bring that in today. The project that we have inside of one of the pieces of health and health care is this project on fall prevention at Brigham and Women's Hospital. It will be a research project as soon as we get our $5 million in place that will test Tai Ji Qijong along with Western-style exercises and a pharmacological intervention with a new generation of SARMs, they're called. They're like steroids, but with less virility issues for muscle mass. The problem is that my generation boomed in here, so we're called the baby boom generation, and we're going to make a big boom because we're lasting longer. And as you can see from this chart, by the year 2050, 24% of the population will be over 65. Many of us lasting into our hundreds, which nobody ever told me that would happen when I was born. That was records, ancient, something way beyond thought. And now you're going to have millions and millions of people in their 90s and hundreds walking around. So as Andy said, you're going to have more walkers in the trams for old people than you will have baby carriages. As a matter of fact, you already have more Pampers sold in Japan for old people than there are Pampers sold for babies. Just so you see the direction that we're going in. Your pension funds will cut the percentage of how much you're getting. As the years go on, the age of retirement will increase. All of these factors will come to bear on you and your children. So people live longer, and it's so that almost a third of people who are over the age of 60 fall once a year. And 20% of those require medical care. And the medical costs in the United States alone in 1990 were $20 billion, Milliarden, I think, in your terminology. In 2020, that's still coming in a number of years, that will increase to $33 billion. And a short time later, it will explode to $240 billion. That's a catastrophe for the society. It's a catastrophe for you who have to deal with it through people who you know who are old. And we think we have some answers that can help older people not fall and start this process. There is research to show that Tai Chi, which is known as a 3D exercise in 3 dimensions instead of static 2-dimensional exercise, is significant in reducing the rate and risk of falls. But it's new research. It's only 25 years old or so. It needs more work to provide that evidence-based conclusion that Swissmed will buy and therefore put onto the list of what you can get paid for by the insurance companies. We're on that project now to provide more of that evidence-based material. And as it says at the bottom, only Tai Chi, of all of the things that were looked at, show the efficacy of reducing falls and reducing the risk of falls in comparison to any other single intervention.